Good afternoon, this is Dr. Do again. Today's video is an alphabetical list of the problems. We talk about the what kind of problem you need to see emergency room, what kind of problem you can manage at home, or what kind of problems you need to call the physician, make an appointment. We finished the A list. Today we're going to talk about the B. Okay, start with the B. Letter B. I'm going to talk about today is the brain problem. Okay, so what kind of problem you can manage at home if you have brain problem? Pretty much none of them, except there's one exception, which is I talked before, the headache with exclusion of any organic disease. For example, you had headaches, you visit your physician's office, did the whole workup, and nothing found abnormal. So just the headache, the pain. If that's the case, I'm sure your physician has talked to you, has discussed with you, you can manage at home in case you had headache. Other than that, none of the problems you can manage at home. So this is clear. What kind of problem you need to see the emergency, and you can call your physician as make appointment, not urgent. Before we talk about that, let's briefly talk about the brain structure. So brain is wrapped, includes by the skull, have the frontal, temporal, occipital, and parietal. Basically, these are the skull name, and the brain named under the same name. Have the different lobes: frontal lobe, parietal lobe, temporal lobe, occipital lobe. Okay, so that's the brain structure. Of course, inside the brain there is a cortex, which is the center of the center, okay? Dominant all the activities, control everything. And then they're different, like there's a midbrain, there's brain stem, cerebellum, and also there's some other eccentric brain, forebrain, or well, I'm not going to go to the details of the brain structure. That belongs to the physician or anatomy. But I'm going to briefly talk about the function of the brain. You already know it. Sensations, for example, the parietal lobe on the top, on the apex of the brain, is responsible for the sensation, and the frontal, the motion, temporal is the memory or emotion, and occipital associated with the vision and hearing, and there's some small structure inside of the occipital is called cerebellum, which is responsible for the balance. So this is, just briefly introduction of the brain. And then let's talk about what kind of brain problem you need to visit the emergency. Pretty much, if anything new, you need to check it out, okay? For the emergency visit, injury, any trauma, especially if it is associated with the loss of consciousness, associated with the muscle weakness, sensational change. Some of them you can call physician to make appointment, and you can wait. But I recommend go to the emergency regardless of what, if you have severe injury. And the other brain problem you need to see the emergency is headaches. Very severe headaches, young or old, with fever, high fever, severe headaches. Especially there's a special symptoms called projectile vomiting, which means your brain and the meninges, remember there's a membrane structure, was irritated, means there's severe infection. So if that's the case, severe headache, fever, projectile vomiting, and you probably with consciousness or loss of consciousness or feel confused, altered mental status, definitely this need to see the emergency. Doctor will examine you, take the fluid, cerebrospinal fluid, to check whether there's a bacterial or viral infection for the brain problem. And for the older people, these could occur. Either the injury or the fever could occur in young or old. But for the older people, there's some more signs you need to look up. Just be careful with yourself. A lot of problem might be subtle, but suddenly becomes deteriorate worse. So, for example, you probably know, especially those had a past medical history of hypertension, diabetes, your physician already gave you the warning sign, what kind of problem you need to be alert, you need to see the emergency room. For example, change of sensation, either you feel headache, or with or without headache, you feel you cannot raise your arm, or cannot lift your leg, or if somebody touch you, or you touch yourself, you cannot feel it. Or check your muscle strength daily. This is coming with the preventive measures. So for those older people with previously medical problem, check yourself every day, the muscle strength. You squeeze your hands and you lift your arm up and down and make all directions movement, and associate with your leg and then your toe and your feet. So this is just briefly every day you check it. If there's anything unusual or you feel like something's going on, you check with your physician, call them, and they may say go to emergency room, or you just go to emergency room directly, because if it's stroke, there's a timeline. One can be used the thrombolytic medication to break the thrombus down, break into small or dissolve it. So that's the emergency really for the elderly people, history of hypertension, with or without. All right. What is the category, the brain problem? You can make appointment, call your physician. Something subtle. I really recommend, because the brain is so fragile, so important. Any problem could be very serious, could be life-threatening. So, and also every minute is countable, especially for older people, the stroke. They have there's a guidelines 3 hours. If beyond that 3 hours, there's nothing they can do. You just watch it and recover gradually. So for older people, anything happened, go to emergency room. Every minute is life-saving. Okay, for the young people, there's something you can just schedule your physician, just daily visit. For example, you have sinusitis, previously you had it, now the season in the winter it's coming back again, you know it, and so you can just call your physician, I need some check out and prescription medication and to treat if it's bacterial infection. The other kind of headache, like migraine headaches, we already talked about the migraines or tension headaches, you probably know, but the first time, always, the new onset of headache, regardless what is the cause, if it does not go away for a couple of days, call your physician to check it out, to make sure everything is okay. All right, this is briefly a message or discussion on the brain. Pretty much, actually, it's kind of the subtitle, the stroke. What kind of sign you need to see your emergency room to take any minute, just go there without hesitation, without delay, so to gain the time and treat early. All right, I hope it helps. You probably already know it. If you have anything interested, I would like to talk to you, discuss with you. Thank you for watching, and I will see you next time.